Hello once again. This is week 3 discussion post. Case study 1 response. As far as the case of Vietnamese woman and her children is concerned, the practitioner needs to develop a culturally competent understanding of the problem. To begin with, one ought to note the concept of conning, a form of traditional treatment used in Vietnam that involves rubbing the skin to cause red marks, similar to that made by a comb. As a practitioner, my actions would be to ask the family questions and refrain from making an impulsive decision of abuse, thinking about their culture and their way of living. I must make myself and the medical staff aware of such a cultural practice to avoid any conflict and difficulties in treatment. Concerning cultural competence issues, I would ensure all staff members work towards acknowledging and appreciating cultural health practices. This entails addressing comparable incidents, such as providing a code of practice and an interpreter if needed. Moreover, one should avoid making assumptions and use appropriate language when talking to the family to learn more about their health belief systems, which will gain the patient trust as they feel they are not judged. Some assessments related to the cultural competence of this patient include understanding the central health beliefs regarding common any use of traditional medicine treatment for this patient, and the family's view on biomedical treatment. Also, it would be appropriate to examine the possibility of any cultural communication barriers and work on eliminating them through cultural appropriate interpreters or cultural mediators. This involves respecting the patient's cultural beliefs and improving the patient's care outcome. Case study 3 response. Analyzing the case of a 69-year-old Iranian immigrant, Mr. Tabrizi, there are some preoccupation that the hospital and the doctor could have been more accommodating to the patient's culture. Firstly, the management of St. Vincent Medical Center should have arranged for a medical interpreter who knows the Farsi language from the start. This is because relying on the sun for translation can be very slow and slippery, which can, in one way or another, create misunderstanding and stress on the side of the family. Professional interpreters can provide precise and comprehensive translation, which is very sensitive, especially when diagnosing a patient's problem or developing the best treatment plan. Moreover, the medical staff should have provided more attention to Mr. Tabrizi dietary restrictions regarding his religious beliefs. Integrating these considerations with the hospital kitchen made Mr. Tabrizi feel that his special dietary needs were recognized and would be accommodated, and he might have been motivated to adhere to such medical advice. Such measures are proactive measures that show concern and respect for the religion and culture of the patient. When diagnosing, the doctor should have been more careful due to his cultural background and the patient's psychological state. Dr. Luke could have conveyed the information compassionately and in pieces rather than in a way that might have come across as rude to ensure that the son understood it as medical professionals do. Other measures aimed at strengthening cultural sensitivity, such as hiring an interpreter or a patient advocate who is aware of Iranian culture and can support the family during the interaction with doctors, could have been carried out. Thank you for listening.